It's wonderful. And today we have our guest again. I love when she comes to join us.
Hello,
Karina.
everyone. I'm back. You can't get rid of me here.
Yes, it's Karina. And so today we're lucky to have Karina here, Karina Lozano, and she is our medical assistant as well as our surgical assistant and surgical tech. So she wears a lot of hats. And I asked Karina to come and join us today because we were going to talk about how to prepare ourselves for surgery, in particular for cosmetic breast surgery.
Right.
And I appreciate you coming on the show, Karina.
Well, thank you for bringing me.
You're most welcome. And so just for our listeners, and again, thank you always for listening to us on KSRO 1350 on Ask the Expert here on Thursdays. We really appreciate you just tuning us in. And I want to just share with those of you out there that actually today is week number 5. I actually had a total hip replacement, a right total hip replacement. And that goes, and Karina is kind of looking, at those who are listening just on radio, this is going to be on YouTube as well. She's kind of shaking her head because Karina used to be a orthopedic medical assistant. Is
Yes,
that
I
correct?
did. Yeah, I was.
Yeah, and worked for a good friend of mine, and then we were lucky enough to grab her away. I don't know if he's my friend anymore, but we were able to get Karina to come and join us. And Karina, so as I was preparing, did you notice me doing anything differently for my own surgery?
I would definitely think so. I think you were definitely drinking more water, staying a little bit more hydrated, getting your walks in, your workouts in.
Right, I was preparing.
Yeah,
right,
you were
I was going to, and so what I was really determined to be was, and you're going to laugh when I say this, I was determined to not be the typical doctor patient who's really bad at following directions. Okay, we're the worst. Well, maybe the nurses join us in that group of bad following patients. Okay, we just don't behave. And so I was really determined to really follow and go by the book, my orthopedic surgeon who did my right hip replacement. And I have to say that I really feel that because I prepared myself for it, Karina, and I hear you talking to our patients all the time and giving them information, I really try to stay focused. I read everything that was given to me, and I really think that led to me recovering so quickly and really being back at work within about 5 days. I know I'm crazy, but doing that but just following the directions, it makes a huge difference.
Right. Yeah, I think it did make a huge difference. And you were at work, but you were still following your doctor's orders.
Okay, good. I'm glad you said that. Yeah, don't out me here. Don't rat on me.
By doctor's orders, you were back.
That's right.
To work.
So Karina, as we move forward in the show, and let's just talk about cosmetic breast surgery this time. So cosmetic breast surgery would include breast augmentation, of course, with implants or with fat transfer, breast lift,
Right.
and sometimes even breast reduction. So let's kind of group them together just for this conversation. And I know the patients come in, and you and we evaluate them. I do a consultation
Right.
and go over, what the pros and cons, what the results are, and give them those kind of information. And then I really turn them over to you, and to really go over their pre-op education. Although I spend time with them, you really go into a lot of detail. How much time do you spend with the patient when they come in for a pre-op visit?
I would say they have, I think it's about a 30-minute time span, 30 to 40 minutes.
That's 30 to 40 minutes with you,
just
right?
with me,
right?
And then we have. Oh my gosh, I should know this.
with you and I together, we spend about another half hour. So we spend about an hour. That's how important we feel it is in terms of educating our patients to get the best results. So even though I guess the last 15 minutes, Karina thought it was 45, I think she was sleeping in the back. I'm not sure. But, no. And so, but a good part of it, that first 30 minutes, you're going over things with our patients. And so what kind of things do you cover with our patients to get them prepared?
We actually cover a lot of what to do before and afterwards.
Okay.
Today we're talking about what to do before surgery. And really just sending them home with appropriate information in writing as well, so that if they have any questions, they can review that. But I think today we can go over a few things that we don't usually, we do go over, but we don't go over in depth because we have limited time, and then they have their own questions. We want them to have enough time with you. So we can probably discuss those few nuances that we usually don't.
Let's do both. You and I have half an hour here, or less than that right now, with Michelle in studio here at KSRO. What are some of the first basic things that you go over with the patient, besides signing consent forms and those kind of things? What kind of directions are you usually advising the patients on?
We're definitely advising, the patient to get their lab work done. If they're over 45, I believe, we want them to have a mammogram, or if there's any history of any, sort of concerns with breast, we want to have that ahead of time. We definitely say drink water before surgery, about a week before. No alcohol consumption in large amounts about a week before.
So why do we have them hold off on large amounts of alcohol consumption? Okay.
We definitely want the patient to not have the risk of bleeding, right?
Right. So alcohol, that's right. So a glass of if you want, as long as it's good red wine from Sonoma County or Napa County, okay. As long as you cover our two counties.
Me up, Dr.
Thomas. We're not biased at all
As
here.
long as it's a good glass of wine, I'm fine with that the night before. But we just don't want to be having you drink a lot for a couple of reasons. You were right, Karina. So number one, it can cause bleeding, and certainly we don't want that with your surgery. And also, it's a diuretic, and it tends to dehydrate us, and and we want you to be well hydrated.
Yes.
Okay.
Yeah,
what else do we tell them besides that they can't have too much?
The joke always is don't have a big Vegas trip planned the week before your surgery, right? That's just the joke I always say. No big Vegas trip.
That is true, and it makes a big difference. It's very true that if you prepare yourself for this procedure, any kind of surgical procedure, whether it's, I had a hockey injury, that's why I had a total hip replacement, but for cosmetic breast surgery, is if you prepare yourself ahead of time, you're going to sail through the operation. We have had occasionally people who just think, oh, I'm just going to go in. I'm going to go in and buy a car and drive off, and they don't realize it's their responsibility as well. They're part of our team.
Right.
We talk about that. I always introduce Karina. We have Bridie, who's our other medical assistant and surgical scrub tech, and then we have our nurses. There's Taryn and there's Heather, who are our lead OR nurses. Introduce them, but I also look at the patient and I tell them, you're part of the team. Okay, we're together. We're working to have you get the best results. So you have to participate and get yourself in the best shape. So you mentioned about hydration, so that's going to be important. And we do things all under local anesthesia, so as opposed to general anesthesia. So when I had my hip repaired or replaced, I couldn't have anything to eat or drink after midnight.
Right.
Okay, and luckily I negotiated. I brought donuts over to the orthopedic surgeon's office that they'd get me in as the first case. Okay, that's a true story. It was amazing how dehydrated I felt when I went in, and normally I have big veins to start IVs, and just by not being able to drink in the morning, how my veins were not as full. So luckily with local anesthesia, can they drink all the way up to the time of surgery?
Yes, so we do want you to have breakfast, and you can drink your water with breakfast that morning. We'll let you go to the restroom many times before, so if you have to use the restroom before, we just don't want any caffeine, so no coffee or caffeinated teas, because we want you to be as relaxed as possible for the procedure that day.
That's correct. So a lot of people are used to having a couple of cups of coffee like me in the morning, and so we don't want you to have that because we don't want to have you wired. Basically, we want you calm, right?
Nice and relaxed.
Right, okay. So what else should the patient do in terms of getting prepared for the surgery?
We always recommend that you have lots of ice packs pre-made at home, whether you buy them or you get peas or you make them with Ziploc bags, whatever it is. Icing immediately after post-op for breast is really important for swelling and bruising and discomfort. It helps with that. So lots of ice packs.
It makes a big difference. Ice makes a huge difference, and having just gone through a major operation myself, I can tell you that it makes a big difference. And it was funny for me, Karina, so as I was being the patient, I think it helped me to kind of take away any anxiety or fears that we all naturally have, right, when we're going to have a procedure, is that I got into my clinical head, and I was sort of watching everything that was going on to try to learn and see if there's anything new that they did that I thought, hey, that's kind of cool, and let's bring that over to our office and we can offer that. And one of the things that they did is they actually had large gel pack, which were maybe 1 foot by 1.5 foot. I mean, these are good sized gel packs to put over my hip and sent me home with that. So we now have that at our office, right?
Right, we'll send you home with one of those. That's nice and cool, so you can be icing on the way home.
That's right, and so you put it right over the chest area. It helps to ice it down and make you feel comfortable. For a lot of people, just so they understand, for post-op pain, and this is all preparation, we do call in there, or actually you're in charge of that. What do we do for medications for the patients?
For medication, they will pick up before surgery, and they'll be picking up gabapentin for discomfort and a narcotic, either Percocet or Norco, depending on what you write up.
What I prescribe. Okay. So one of the things that I just want to go over, and so we call in. Actually, it's online now, and Karina helps me to do that for our patients. Is that we write for pain medication, and so gabapentin, which is also a brand name, is called Neurontin, which if people look it up, it's really for nerve pain. But we're finding that we're using it in cosmetic surgery, and that it helps to minimize the need for using a narcotic like oxycodone, or the brand name is Percocet, which is commonly what we order, or Norco or Vicodin. And what people should understand is that the narcotic pain medication, you've heard me say this, Karina, I like to call it, I say it really shouldn't be called pain medication. What it should be called is, I don't care that I have pain medication. Okay, I don't care that I have pain medication. And so what it does is kind of numbs your brain, so that even though you're still experiencing the pain, you just don't care about that. And so that's why, and the reason I'm telling you that is it helps to kind of numb your brain to the pain incoming signals. But that's why ice is so important. And I know that you had just relayed in the past when we did our post-operative care, and you had mentioned how important that icing is for our patients.
Right, so having that ready and prepared, and you're not
so
last minute going to the store.
Absolutely, so you should have that ahead of time. There will be a whole list of things that we have you get prepared for. So the patients are, they do that, they get their labs done ahead of time, they get their medications ahead of time. We do the procedure, we do it all under local anesthesia. We give you some oral medication, which helps to make you feel more zen-like doing the procedure, and we'll kind of skip through that part. But on the day of the operation and they come in, so what can they expect beforehand?
Yep, I want to go back to another thing really quickly.
Okay, we skipped something? Okay, all right, okay, you gotta keep me straight.
I think mental preparation is a big factor for the patient. We're really coaching them and saying, this is an operation. You are going under an operation, you will be awake, but really preparing the patient to be aware that there may be some discomfort, and that's normal. So really mentally preparing the patient as well for what is to come, and mentally, and they can kind of be home and prepare for that.
Right. So for most people, for our listeners, most people, being educated and knowing what's going to go on helps us to be prepared, because a lot of times our anxiety, anxiousness, being scared is of the unknown, right? Is of the unknown. So we do spend, I mean, that's why my consultation with them initially is an hour, and then they come in, and although Karina thought it was 45 minutes, it's actually an hour we set aside. It's a half hour with Karina, and then it's a half hour with Karina and myself visiting with the patient. So they get about 2 hours with us before they even come in for their operation. And that's really, really important. And so just again, it's really good for us to kind of, so I had to get my hip replaced. I didn't want a breast dog, okay, for myself. So I got my hip replaced. And but what was good is going through that. And one of the things that I picked up, my surgeon or the team didn't do that. They did have a nurse call me, just like we have our nurse call the patient ahead of time. But something I picked up was just actually I text my patients afterwards. I call my patients for the first 48 hours. I call them each day, communicate with them. They have my personal cell phone number. but I just started to actually text the patient ahead of time. And just to say, let's pretend their name is Natasha. Okay, and I'll text them ahead of time, say, Natasha, this is Dr. Tom, you're going to do great tomorrow, and which I mean, and that I obviously believe,
Right.
and and it gives them an opportunity if they have a last minute question to reach out to me, and most people really appreciate that. Okay.
Yeah.
So do they do anything? Do they take a shower? Anything else before they come in to see us on that day?
On that day, we want you to shower, come clean, no makeup, perfumes, jewelry, no nail polish, just come clean. It's important if you want to wash your hair, get that out of the way. You won't be, you'll be sore. So using your arms, it's not impossible, but it makes it easier if you've had hair wash days scheduled.
Right. And so
Yeah.
I would agree with that. I think, taking a shower right before you come in, or a bath, probably a shower is better, is great to minimize infection, surgical infection. So that's number one. Usually when we're doing breast surgery, there's no shaving involved, but let's say for a tummy tuck or maybe another procedure where somebody has hair growth, we don't want them to shave, because shaving ahead of time can actually stir up bacteria with nicks in the skin. So we would have you come in and we would shave you right before we do the procedure, and that's shown to decrease the risk of infections as well. So showering is important.
Right.
And one of the things that I am going to recommend is that there are Hibiclin pads that they can now get, and they can wipe themselves off before they come in for their surgery. So they're staying well hydrated. They're eating, so we keep their blood sugar up or their blood glucose up. We mentioned the shower to minimize that. They're avoiding caffeine.
Right.
You had mentioned that as well. Is there anything else that they need to keep in mind as they show up for their procedure?
Right before the procedure, or just be way ahead of time. I'm sorry. There's other things in my head that are coming up that I'm like, this is really important.
Okay, all right. Let's go with what's muy importante. Let's do it. Okay.
Planning for everyday things, right?
Okay.
So things like childcare, who's gonna walk the dog,
so
all those things.
You can see here I am. I'm the spoiled firstborn, and and I hire all these people to take care of me. Karina's also a mom, so she knows. Okay, so she speaks from experience. So it's lining up your home situation.
It's lining up everything. That's all very important.
Absolutely. And it's probably where I'm frustrated with the patient not listening to us is when they don't believe us and we tell them they need to give themselves time to recover, right? And oh no, I can do it on myself, and you're doing it under local. I don't need anyone to spend the night with me. Okay. And we tell them, especially when they're on their own, and we tell them you have to. Somebody does have to pick you up. We can't call a ride like an Uber or Lyft.
Right.
We can't send you home with a taxi. You have to have somebody that you know who's going to pick you up and make sure you are safely delivered to your home.
Yes.
Okay. So all of that is actually for our patients' own good, so that they are safe and that they can recover well. Okay. Is there anything else that you can think of?
I think we're okay. I think we've covered all the.
Okay. So those are the things that they're going to do beforehand. In terms of afterwards, what do you think? Kind of part of preparation and what we do beforehand is preparing ourselves for afterwards.
Right.
And you had mentioned icing. Is there anything else that you think is important for our patients in terms of getting prepared for surgery?
I think that would be it. Yeah.
Okay. So what I would just tell our patients is that when they come in, they're gonna read, and please read through that. We spend a lot of time writing out our instructions for you so that you will understand each step of the way, and sometimes it's multiple pages. I got a booklet when I had my hip surgery, and I'm like, oh my God, I fell asleep about three nights in a row, trying to read it, but I was determined. Remember, I was not going to be that typical bad doctor patient, okay?
Right.
And so read through that information. There's a lot of information there for you, and you might have to read it a couple of times. The other thing that I would recommend is that whoever's going to be taking care of you, they're in charge of you, okay?
Yes.
They're your care partner, and I would have them read it as well.
Right.
I know a lot of times with cosmetic procedures, do patients tend to be kind of secretive about it?
I would say, but they usually, whoever's bringing them is someone they trust,
Okay,
right? So it's
right.
probably someone who knows, we hope,
We are,
what
right.
they're getting themselves into.
Right.
Yeah.
And so what I would say is this is going to be a time, and for those who tend to be private or a little bit secretive about it, is so you have to kind of open up, and whoever's taking care of you, let them read those instructions, okay? That's important, because when you are after surgery, even though you have less discomfort with our procedures because they're done under local anesthesia, you're still going to be taking medication. We did give you a little oral medication, I call it Zen in a pill, and so you're not going to be as with it mentally to help to direct your care. So you want your caretaker partner, your care partner, to be well educated so that they can do the best job in taking care of you. So so the patients are coming in, and they're a little nervous, okay,
Yes.
Karina, and so who do they see, and what's the process before we enter into the operating room so that they understand what's going on? What do you tell them to expect?
First point of contact is going to be the nurse that morning. So
Okay.
I always say arrive at 8 a.m.
Okay.
And then the nurse will greet them. How are you today? If they have, their drivers coming in, they can come in with them. We can take the information
Okay.
for as to when to pick up, when to expect that phone call that, hey, we're ready for you. And
Right.
we will give your ride about a 30-minute warning. If they require more, we always make sure to collect that information. And we go into the room, we let them use the restroom, so we're not rushing through anything.
Right.
The nurse is taking her time with the preoperative. We'll start an IV for the patient. The nurse will get that ready.
Okay.
And they're about an hour before we actually go into the operating room.
That's correct, and so that hour is not because we just want you to sit there and wait. It's because it takes that long to prepare. We get the room, we open up all the instruments, which have to be sterile, so you only open up within a specific amount of time beforehand. You don't open it up the night before because you want everything to be sterile for the procedure. So the patient comes in, the nurse meets with them. You mentioned that they start an IV so that we have access to give an antibiotic and fluids. Okay, we don't give any in our office. We don't give any IV narcotics or sedation. Everything is oral or pills that dissolve under tongue. So that's really nice for the patient. One of the things we do is something we call a timeout. And so what does a timeout entail?
Timeout is ensuring that we have the right patient, right time, right procedure.
Right.
Yeah.
So we do a timeout, and we do it 3 times, okay? So we really only need to by accreditation standards twice, but I'm so OCD that I really want to make sure that we always do, as you mentioned, we're doing the correct patient, we're doing the correct procedure on the correct site. So we will ask Natasha, what is your name, and give your full name. We actually ask them for their social security number. What else?
Last 4 digits.
Yes, last 4 digits.
Date of birth. What are we doing for you today? Any allergies?
Right, and then I review their medical history with them as well to make sure there's nothing's changed, because I might have seen the patient only a week or 2 beforehand, but sometimes things can change. So we'll go ahead and do that. If the patient is under 55 years of age, and is there anything else that we do when they go to the bathroom?
We do a pregnancy test.
There you go.
Just in case.
That's right. So we do a pregnancy test, and so we want to make sure, obviously, that you're not pregnant if we're doing the procedure. We do a blood pregnancy test ahead of time, and I was joking with one of the staff members in the office because we were looking for our guidelines as to when can you stop doing a pregnancy test. And Michelle, what do you think the age is for stopping that?
I don't know, like 45 or something?
It's 55.
55?
Yeah, 55.
My goodness.
So our staff member, it's actually 54, so our staff member hit 55, and we kind of laughed, and we said, oh, I guess we don't have to do a pregnancy test on you anymore, and she was cracking up. So we do a pregnancy test on there, and then we have the patient prepared. I'll come in then at that point in time, and if we're doing, for instance, an augmentation with implants, I'll mark off things. We'll take photos as needed. We take lots of photos all the time, and answer any other questions for the patient. And then we bring the patient into the operating room, and we once again do another timeout. So the nurse has done a timeout. I come into the pre-op area and I do a timeout, and then together as a surgery team, we do a timeout Then we go ahead, the patient's lying on the table, we sterilize the surgical site area, drape everything off, and then we start to do the procedure. And I think, Michelle, you have a question?
I do have a question. You say that you're taking a lot of photos. Is that just so that you make sure for the, your record keeping for the patient, or is that for like before after kinds of things?
It's for both. So
Okay.
we, because patients always want to know what the before and after is, and also it helps because when we take photos, so we evaluate a patient live, obviously, and then we take these photos, and so we can look at them during the procedure, and we can go back to them for reference because we take them the photos of them standing up. Most people look at themselves standing up, not lying down, and so we want, and when we're doing the surgery, obviously they're lying down on their back. So that's the reason that we do that. And so, and then patients, of course, we always give them the before and after photos. They love seeing that because they forget what they look like, and then they go, wow, and they're really excited. So, we really appreciate it. Karina, thank you for joining us.
Yes,
I
of course.
appreciate it. And thank you for always tuning in for us here on KSRO 1350 on Ask the Expert. And we will see you next week. Thank you,
All right.
everybody.
See you soon again.
Yes.
Bye.
You can always make a consultation with Dr. Walter Tom of Dr. Tom Cosmetic Surgery. He has offices in Santa Rosa, Napa, and Maui. You can go online to drtomcosmetic.com or give a call to 707-542-8346. This is KSRO.